This video demonstrates 3 examples of pressurized canaloplasty using the iTrack Advance. This is an example of a standalone canaloplasty in a pseudophakic eye by Dr. Mary Keel. We're sitting temporally and operating on a right eye. A paracentesis was made infratemporally and flared towards the nasal angle. Lidocaine and myostatin were injected into the AC, and the AC was filled with Helon Pro. The iTrack Advance was inserted into the AC. The spatulated cannula tip was used to score the nasal TM, and the actuator was pushed forward to advance the catheter into Schlemm's canal. The blinking red light at the tip of the catheter can be seen. As the catheter is advanced all the way around, the viscoinjector is clicked 3 times per clock hour, dispensing 2 to 3 microliters of Helon Pro each time, performing a pressurized canaloplasty. Blanching of the episcleral veins can be seen, and the microscope is focused up to highlight the blanching. This is an example of a canaloplasty combined with cataract surgery by Dr. Mary Keel. A paracentesis has already been made. Lidocaine was injected into the AC, and trypan was used to stain the anterior capsule and the trabecular meshwork. The AC has been filled with Helon 5, and a main wound has been made. A Sinskey hook can be used to make a small goniotomy in the nasal angle to make it easier for the trainee to dock the cannula tip and insert the catheter into Schlemm's canal. The blinking red light at the tip of the catheter can be seen. As the catheter is advanced all the way around, the viscoinjector is clicked 3 times per clock hour, performing a pressurized canaloplasty. Dramatic blanching can be seen in this example. After the canaloplasty was completed, the routine phaco proceeded uneventfully. This is an example of a canaloplasty combined with cataract surgery by Dr. Jonathan Eisenberg. The catheter has already been advanced for 360 degrees around Schlemm's canal, and no viscodilation has been performed yet. As the catheter is retracted back into the cannula tip, the assistant turns the viscoinjector 3 clicks per clock hour to dispense Helon Pro into Schlemm's canal, which accomplishes a pressurized canaloplasty. Dramatic blanching of the episcleral veins can be seen. After the 360-degree pressurized canaloplasty has been completed, the cannula can be removed from the AC, and the phaco can proceed as usual. In summary, when performing canaloplasty, keep the following tips and tricks in mind. Trypan blue can be used to stain the TM, which can be particularly useful in eyes with very lightly pigmented TMs. The spatulated tip of the cannula can be used to make the otomy to start the procedure, or this can be done separately with a Sinskey hook or MBR blade, for example. The canaloplasty can be done as the catheter is advanced around Schlemm's canal or when it is being retracted back out. We recommend using Helon Pro in the catheter, but Provisc can also be used. While performing the canaloplasty, it is important to keep the AC well maintained to ensure a favorable pressure gradient to minimize the risk of a decimate detachment. If the blinking red light disappears from view, the catheter may have tracked posteriorly into the suprachoroidal space, so the actuator should be pulled back to retract the catheter, and another attempt can be made. It is important not to inject viscoelastic when the blinking red light cannot be visualized. The post-op drop management for phacocanaloplasty can be the same as for standalone phaco. When performing standalone canaloplasty, a lower frequency of topical steroid can be used, and it can be tapered faster. Thank you so much for watching our video. We hope you will consider trying the iTrack Advance to perform 360-degree pressurized canaloplasty in patients with open-angle glaucoma. Please email us if you have any questions.